Hey everybody. So we're going to take a look at the presentation for week 2, and we're talking about essentially disease transmission. We'll also be talking a little bit about incidence and prevalence. Okay. So again, just kind of a review of some of the stuff that we talked about last week. One of the main points is to identify the root cause, the etiology, and some of the risk factors associated with specific diseases. And of course, we want to identify the extent of the disease in the community. So we just took a look at incidence and prevalence rates. Natural history of the disease, it's pretty important. This is what I did my actually graduate thesis on: natural history of varicella, which is the chickenpox vaccine. So, what happens to the average person that comes down with a particular disease, and how does that disease progress? Because, pardon me, when somebody's diagnosed with a disease, if it's terminal, the first question that they're going to ask is, "How long do I have to live?" So we need to know the prognosis. Is it terminal, and how long do I have to live? Those are going to be the two main questions that people are going to ask. So that's hopefully what epidemiologists are going to be able to determine. We'll talk about evaluating health programs in the next couple weeks. We'll talk about that a little bit more, but we also need to know if we institute a health program, is it actually effective, and is it worth the money that we're putting into it? There have been some programs that actually are not really effective, unfortunately, but there's been some really great programs as well. I posted I can't remember if it's this week or next week, the article by Harvard talking about why epidemiologists are so wonderful and why they should be more involved in regulatory decisions. So there's some pretty important. I encourage you to read that article by Harvard. It's got some really good points. So primary prevention, obviously, that's what we want to try and do. Um, Vaccination programs are really very important in public health, obviously, but could also be nutrition programs or STD prevention programs, things like that. And then secondary prevention. This is where we do a lot of cancer screenings, not just cancer, but now they're doing diabetes, pre-diabetes screenings, kinds of things like that. And again, we talked again last week about descriptive epidemiology, data collection. Um, used to determine the prognosis of a disease, and then which is then useful for clinical medicine. And then it can also be useful to decide on an appropriate therapy. So we're going to talk a lot about evidence-based medicine in this course. People by now, if you've watched U.S. Healthcare, the good news, you know that not a lot of clinical decisions are based in evidence. They're based on tradition or a variety of other reasons. But it's a relatively new concept in allopathic medicine. So this is what I want to talk about a little bit more because there's a question on our test about this: the disease transmission and the what we call the epidemiological triad. So disease results from the interaction of the host, the person in this case, because we're primarily talking about human illness in this course, an agent, the environment, and then the vector or the delivery system. So I'm actually going to be bouncing back and forth between two different presentations here because there was some information on last week's presentation about this. So you can apply the epidemiological triad to almost anything, and this is what you're going to have to do for this for the test. So again, the host, if we're trying this triad to smoking-related diseases, there's probably some genetic susceptibility to lung disease. There's also susceptibility from an income level standpoint. Um, you know, uh, Smoking is much higher. The smoking rates are much higher in low income areas for a different variety of reasons. The agent in this case would be the cigarettes themselves, the environment. In this country, in this culture, we don't really smoke very much. We're down to about 19%. So versus 50% of the population was smoking, 60 years ago. So and 50% of men worldwide smoke. So less than 20% smoke here. So we've cut back on advertising. There's peer pressure on people not to smoke anymore. And then the vector would be the delivery system, the manufacturers, the distributors, the vendors. So I just have some additional information just about some of these aspects of the triad. So the agent, again, it's the typically we think of it as like a parasite or a virus, but it can also be a physical force, like a motor vehicle, a car in the motor vehicle accident, or a chemical, an environmental situation, a nutritional imbalance, as within rickets or scurvy, something like that. So, several characteristics important to consider: infectivity, the capacity to cause infection. How virulent is the agent? The severity of the disease that's going to result from this agent, and then the pathogenicity, the capacity to cause disease in a host. The host, again, the person, or if we're talking about veterinary medicine, particular animal. The status of the host is important. So it's either you're either susceptible, immune, or affected. So we have big problems now with people, children, getting things like measles because they haven't been vaccinated. We know that there are outbreaks of things like polio and measles, especially in like Amish communities where they don't like to vaccinate. So a lot of these people are susceptible, and then the people that have been vaccinated are immune. Okay, and again, the host response to exposure can vary widely. It depends again on genetics, depends on how strong their diet is, could depends on a whole variety of reasons. Then the environment, the conditions or influences that are, not part of the agent or host, but still influence their interaction. So it could be physical, related to climate, biological, social, economic conditions come into play. So there's a whole variety of reasons why the environment plays a part. So they don't talk about the vector here, but they talk about the agent, the host, and the environment. But we also need to consider the vector as well. Again, the delivery system. So, my computer doesn't want to move. There we go. If we're talking about malaria, for example, again, the host is the human. The agent is, I think malaria is a parasite. The environment, let's talk about the vector. The vector is the mosquito. The mosquito delivers the malaria into the humans. And the environment would be any environment that kind of is I don't want to say encourages, but where mosquitoes are prevalent. Swampy conditions. They tend to malaria tends to be a big problem in. So this is one of the things that we're concerned about with climate change, because parts of the world are getting warmer, and we're going to see, or what they are saying is more cases of malaria in certain areas. Obviously, it's climate change. It's not global warming. That's not the appropriate term anymore, because the climate isn't universally warming. It's changing in different parts of the world. So the environment can play a part. If we're talking about socioeconomic status, in certain areas that can certainly play a part. So there's a lot of different things that different roles that environment can play. Okay. And then they talked about this. We talked about this last week. Endemic, epidemic, and pandemic. Just some more information there. I have a pretty good an additional website that talks about herd immunity. But essentially, the idea is that when a large portion of the population is been vaccinated against a particular disease, pretty much everybody in the community is going to be protected, even the people that have not been vaccinated. Now, we're seeing a problem with this is because more and more people are choosing not to vaccinate their children. So we're seeing that certain diseases are starting to pop up, and we're not really protected by herd immunity as much as we would like to be. So I've some cool pictures that explain this in a little bit more detail. But it's kind of a cool concept. Disease transmission, it can happen person to person, direct transmission. Somebody sneezes in your direction or coughs, or they wipe their nose with their hand. I'm sorry, I'm being a little gross, but and then they have the germs on their hands, and then they shake your hand, something like that. Or it can be indirect through vector like a mosquito, or a doorknob, or a sink in a public restroom. Public restrooms in general are breeding grounds for a variety of bacteria. So just be careful, and viruses. So just be careful that you're washing your hands and being very careful. Contaminated air can be an indirect source of transmission. Okay, so um, these are three critical variables when we're looking at epidemiological, or when we're doing investigations. Um, when did the exposure occur? Um, when did the disease occur? Because we want to know what the incubation period is. So, how long did it take between the exposure and the first symptoms of the disease? Because if somebody is exposed, we want to know if we need to quarantine those people. And obviously, there's all types of ethical considerations when you're talking about quarantines. So they talk about this in the book, which is why I kind of threw this in here. Um, and then again, this is something that I do for my on ground classes for my undergraduate students. Um, and you don't have to do this, but evaluate one of the following epidemics or potential epidemics for attack rate. How many people that were exposed actually came down with the disease, the occurrence of the disease. Who, what, when, where, and the root cause. So we talked about Legionnaire's disease a little bit already last week, and there's some information on this slide about that. The Chernobyl disaster. It's kind of an interesting situation to study. And then something that I think probably we're getting a lot more information about now: head injuries in college athletes. I think I mentioned I coach rugby. I coach a women's college rugby team, so head injuries are a big concern in rugby, obviously. And so, the attack rate in rugby is probably as high or higher than any other sport, I think, unfortunately. So, the attack rate is the number of people exposed to rugby. That would be the denominator, and the numerator would be number of people that actually have had head injuries. So for my team, there are 25 women on the team, and I would say probably 10 of them have had concussions over the past couple of years. So pretty high attack rate, unfortunately. Okay, so that's all I had for this one. I hope this was helpful.